Good afternoon. I'm Steve Rehorst, one of the public information officers with the task force here. A couple notes here before we get started. First is that the food distribution is going to be taking place today, and that's with the Salvation Army and the Watertown Community Cares Group. They're organizing that, and that's going to start at 4 o'clock today. What we can do there is vehicles can line up starting at Arrow Avenue and Highway 81 and go east to 9th Street, where they'll meet with someone there and they'll direct them north to the Watertown Boys and Girls Club. With that, there's going to be no access to the Boys and Girls Club from 3rd Avenue, and we will not allow vehicles to line up before 4 p.m. The event will start at 4 and go until supplies run out. So again, that starts at 4 o'clock today, the food distribution there. Another note here, for those that may not have access to the internet or Facebook, if you could please spread the word that these daily briefings are also shown on GovTV and the City of Watertown YouTube page, as well as the City of Watertown's Facebook page, and of course the 2020 Watertown COVID Facebook page. So if you could please get that word out so that everyone can attend these briefings. With that, I'm going to turn it over to Mayor Sarah Karen with our community update.
Thank you. Today is April 9th, 2020. Our COVID numbers in the state are up to 447 with 6 deaths. Cottington County still has a total of 12 cases, and we are now showing that 10 of those have recovered. President Trump said on April 3rd that the cost should be no barrier to any American seeking testing or treatment of the coronavirus. Many insurers are not requiring any co-payment from patients of the virus treatment during April and May. The president also said hospitals and healthcare providers treating uninsured coronavirus patients will be reimbursed by the federal government using funds from the economic relief package Congress passed last month. This should alleviate any concern uninsured Americans may have about seeking coronavirus treatment. All people meeting the symptom criteria should get tested for COVID-19. Please call first, though, before going to the healthcare facility. I've had quite a number of people reach out to me asking me to shut their industries down, salons, for instance. Some say it is so that they can get unemployment benefits. The South Dakota Job Service Office in Watertown has informed me that the state would not use the lack of a formal shutdown as a reason to deny unemployment benefits. In order to be eligible for unemployment benefits, the employer has to have paid into the unemployment program, which many salons and other similar businesses have not done. The good news is that the Federal CARES Act is expected to have funds available to assist small businesses like salons soon. For those that don't participate in the unemployment program, this will be very helpful. In Ordinance 2014, the City Council listed the types of businesses which exist to gather groups of people together for entertainment and recreation, and those businesses were ordered to modify and some to close. To make another categorical level of closure would involve quite a broad number of businesses in order to be fair. We are continuously assessing the idea of ordering all non-essential service businesses closed as an option. We're evaluating whether these businesses' acts of disinfecting before and after clients, wearing masks, washing hands, not touching their face, and so on, are sufficiently minimizing the risk of spreading the virus. I'm hesitant to affect the livelihood of yet another large group of people. At this point, we're relying on the personal responsibility of individuals to be doing their part to control the spread. I believe people are being responsible and that these efforts are working. However, the situation changes daily. We are constantly watching. Please know, when it seems appropriate, I will act quickly to close more businesses in order to protect the public health. Watertown is a caring and resilient community that rallies around each other whenever help is needed. I know we will get through this together, and I want to thank you all for doing your part to help control the spread of the virus. Thank you.
Good afternoon. My name is Marcy Cole. I am the Director of Communications and Corporate Affairs, and with me today is Pat Hogan, Director of Operations. We represent Glacial Lakes Energy. Healthcare professionals and first responders, as well as the general population, are experiencing difficulties in accessing hand sanitizer. We know there's a significant need in Cottington County, as well as the state of South Dakota, for this product due to COVID-19. The Food and Drug Administration, along with the CDC, are temporarily allowing the manufacturing of alcohol ethanol-based hand sanitizer. Glacial Lakes Energy is pleased to announce that we have partnered with Lake Area Technical College, Office Peeps, and the Cottington County COVID-19 team to produce and distribute ethanol-based hand sanitizer within Cottington County. Glacial Lakes Energy will be donating, free of charge, the ethanol, glycerin, and peroxide needed to make the hand sanitizer. Lake Area Technical College, under the direction of Scott Lighthizer, who is the Energy Program Director, will be making the product. Office Peeps, under the direction of Joel Vokraut, will be delivering the finished product. Jamie Torgensen, Sherry Howell, and David Weigel of the COVID-19 team are also assisting with product fulfillment and logistics. This is truly a community-wide effort, and GLE is humbled to be part of it. We intend to fill the need for hand sanitizer in Cottington County through this partnership. At this time, we are providing the finished product free of charge to the medical profession and first responders. This includes, but is not limited to, hospitals, medical clinics, the sheriff's office, police department, licensed daycares, fire department, ambulance, search and rescue, nursing homes, and assisted living facilities. Additionally, Glacial Lakes Energy is also supporting adjacent communities and counties where our production facilities are located by providing the ingredients to produce the hand sanitizer. This morning, we were honored to deliver 250 gallons of ethanol and the ingredients needed to Avera Health in Sioux Falls, South Dakota. We are working with several other counties, including Brown, Beetle, Spink, Clark, and Dual, and we continue to receive requests daily. At this time, we are only servicing the medical community and first responders, not retail businesses, at this time due to the overwhelming need of these other facilities. Again, this product is free of charge to the medical community and first responders. Orders can be placed by contacting me at Glacial Lakes Energy by phone at 882-8480 or via email at mcole@glaciallakes.energy.com. Glacial Lakes Energy will continue to serve Cottington County and the communities that surround us as long as feasibly possible, and we are honored to do so. Glacial Lakes Energy is not immune from the financial impact of COVID-19. All we're asking in return is to support GLE through our Feeling Good with E30 program. The next time you fuel your vehicle, remember to grab the E30 hose. Now is the time that we must unite as a community and support each other. Thank you.
Good afternoon. My name is Carrie Johnston from the Human Service Agency. I'm here today to talk to you a little bit about mental health in a time of quarantine. The first thing that I want to offer you is validation. If you're feeling frustrated, angry, sad, hopeless, or scared, allow yourself to feel that. Don't try to minimize it with frosting on the top by saying, well, at least we have, and then fill in the blank. Because not only does that not make you feel any better, but now you feel guilty about not having that, the worst spot possible. After all, when you're extremely hungry, does it make you feel any less hungry to know there are people starving in another country? It does not. Allow yourself to have those feelings. They are real, and it makes sense that you are experiencing them. Because wherever we are in life, this is new. It's not normal, and it's not fun. It feels like we're stuck in a weird Stephen King novel. We never planned for this, we never expected it. So allow yourself to feel these unexpected feelings. In allowing yourself to feel these feelings, you might be inclined to cry. You might scream. You might want to punch a pillow. You might cuss or want to blame someone, even though it's no one's fault. And my suggestion is to do just that. Do all of those things. It's a release. Our negative thoughts can get stuck in uber chemical production mode of stress and worry, and this leads our brains to produce extra dopamine or serotonin, and that makes us anxious. Crying, screaming, running, just releasing those feelings helps our brain reset a bit and get back on track. And it's okay if you do this once a day or once a week. It's our way of cleansing those extra hormones manufactured by our overactive brain when it's in crisis. The reason that we're feeling this way, by the way, is because we're grieving. We are all grieving something right now. The loss of freedom, the loss of income, financial stability, socialization, safety, seeing family, the right to have funerals for those we have loved and lost, rites of passages such as graduation, confirmation, or class trips. We're grieving the loss of allowing new grandparents to hold newborn babies, visit sick friends in the hospital, or even sit with a neighbor for coffee. Some of us have to reschedule weddings or have them without friends or family. We are all grieving the loss of the life we once knew and trusted. And here's what I have to say about that. Grieve it. Sometimes self-pity gets a bad rap, and we think we just shouldn't go there. And in times like this, it's encouraged to go there. Be sad, feel sorry for yourself, and cry. Do whatever it takes. But like all parties, the pity party will come to an end. It's okay to go there. You just don't want to stay there. Next, and I've mentioned this before, try to reframe this uncontrollable situation into something that we are choosing to do to be in control of our lives and win this battle with the virus. Instead of viewing ourselves as forced to staying at home, reframe it as doing your part. Say out loud and to your kids, we're doing this for the better of our health and to make this virus go away. We're choosing to stay at home so that we don't contribute to the movement of the virus. We're making choices to make everybody healthy and make life better. Viewing it as something we can control does help. I offer you these few tips to get through each day. These can also be found on many social media outlets as well, and we will post it to our Facebook at HSA as well as the COVID 2020 Facebook page. Number 1, stick to a routine. Whatever you're doing for a morning routine in the past, keep doing it. This is for you and for your kids. Expect them to get up, eat, and start homework. Make every attempt to normalize each day with this routine. Number 2, dress like you want to feel. If we allow ourselves to wear yoga pants, hoodies, and hats all day, well then that's how we're gonna feel. Dress to win each day. Number 3, get a fresh air for at least 30 minutes a day. Living in a more rural area or nation, we have plenty of space. Go walk or run or sit outside. And if you can't do this because of your health, open windows and let the shades and sunlight in. Number 4, exercise or move every day for at least 30 minutes. If you can't walk or you don't have home exercise equipment, watch an exercise video. Do something to get your blood pumping and your adrenaline flowing. Number 5, stay in contact with other people. FaceTime, text, or call someone each day. Try not to talk about the pandemic or the news, but other interests. Tell stories, find humor, and do the same for your kids. Allow them to use their devices to reach out to friends. 6, stay hydrated and eat well. Sugar spikes cause us to feel energized momentarily, but then they crash and we feel lethargic and lifeless. Number 7, utilize self-care items like weighted blankets to reduce anxiety or take hot baths. Help children create their own safe space or self-care box where they store crayons, puzzles, coloring books. Anything that appeals to our senses can be self-soothing. Number 8, use this time to play with your kids regardless of age. You might be preoccupied, but set aside time to have a play date with them, playing cards, playing outside, coloring, or putting together a puzzle. This is a bonus time when neither you or your children are with their friends and you're not chasing them around the state watching their activities. Embrace it. Number 9, design an alone space for each person in your family. This is a space to retreat to when interaction gets overstimulating. Use pillows, blankets, stuffed animals, journals, or beanbags. Number 10, and I have to give credit to some random Facebook poster for this one, find something you can control and control the heck out of it. Reorganize your closets, your cabinets, try to find a matching lid for every container in your cupboard. Feeling in control of our surrounding is very helpful when we feel absolutely out of control in our everyday lives. If you have too much time on your hands, volunteer. Review the 211 website for ways you can safely make a difference. Number 12, and I cannot say this one enough times, limit your exposure to the news. Do you know why the honor roll is not on the front page? Because it sucks us in, and it sucks us in more easily than bad news. The media's job is to tell the story of what's going on, but we do not need to see it multiple times a day, nor do we need to know what is going on in a different time zone or a different country. Instead, watch for the helpers, the goodness. Don't watch the beginning of the news, watch the end. This is where they close with the heartwarming feel-good stories of the helpers. This restores faith in humanity and reminds us that we're not alone. It also can motivate us to reach out and help in our own way. Number 13, give everyone the benefit of the doubt every single time. We are all irritable and easily annoyed right now. Remind yourself that that person who is just rude to you or cut you off in line, they may have just lost their job. They may be scared. They may have gotten bad news. Forgive them. Instead of personalizing their actions, think about how helpful it might be to them and to you to just be kind. Number 14, if you are in recovery, please continue with virtual meetings. We have those posted on the HSA website, and we have them on the 2020 COVID website as well. Read the big book and seek support when you need it. And number 15, reach out for help. The Human Service Agency and other practitioners are still seeing clients virtually. We still have crisis services available, and we are still offering psychiatric service evaluations and med management if you feel like you would benefit. And while no one can fix this, we can all work through it and get through it together. I also want to close by adding, I feel very fortunate to be part of the Community Pandemic Task Force, and I sleep better knowing that our hospital, our clinics, our PD, our sheriff, our mayor are doing everything they can to be prepared and keep us safe. Thank you.
Thank you, Mayor Karen, Marcy, Carrie, for all your words today. I have a few announcements I'd like to make before we move on to questions from the media. First, in reference to our homemade masks that we're looking to have our supplies filled there, we are currently looking for people or organizations to donate supplies to make those masks so we can get them to our healthcare workers and our first responders. The specific supplies that we are currently looking for are any colored thread that you can use in a sewing machine, any size elastic, and any color cloth that is a cotton or cotton blend. And of course, please make sure that those items are clean when you drop them off. This is going to be a one-day only drop-off event. So it's a one-day only time that this is going to happen, and that time and date is going to be tomorrow, Friday, April 10th, and it's going to be at the Cottington County Courthouse in their south parking lot. The event is going to run from 11 a.m. to 2 p.m. Again, we're looking for supplies to make the homemade masks for our healthcare workers and first responders. So drop those items off tomorrow, Friday, from 11 a.m. to 2 p.m. in the south parking lot at the courthouse here in Watertown. The other item that I'd like to talk about is our appointment-only blood drives that are taking place. As you may have heard yesterday, we talked about blood centers across the nation are experiencing a decrease in donations, which is why here in Watertown we're holding 3 blood drives next week. Blood donors must be at least 17 years old, 16 years old with a signed parent consent form, which can be found at cbblifeblood.org. Weigh at least 110 pounds or more and be in good general health. Donors exhibiting cold or flu symptoms are unable to donate. A valid identification is required at the time of registration, and it is recommended that a person eat and drink plenty of fluid prior to donating blood. The 3 events that we're having, the first one's going to be Monday, April 13th at Prairie Lakes, and that one is currently full, so we're really excited to announce that that one's full. All the time slots, all the appointments are filled on that one, but we do have 2 other ones that are taking place, and those are going to be on Thursday, April 16th. And they're going to be at 2 different places. The times are going to be the same, but they're at 2 different places. One's going to be at Montgomery's on East 212, and the other one's going to be at the Salvation Army. The times that are available are from 9 a.m. to 1 p.m. and 2:30 p.m. to 5 p.m. And for those, you need to go to cbblifeblood.org. You go there, you click on events, which is on the top of the web page, and then a calendar will appear, and then you click on that date and the event, and you pick a time slot that's available and works for you. You can do it that way, or you can call 1-877-877-3070. Again, this is by appointment only, so make sure and get on there and register. This is an extremely, extremely important thing that we're doing here and trying to get the blood donations in through the blood drive. We're going to post more information on this in the comments section, so please go on there, register to donate some blood. Last time I checked, there are quite a few slots available on those two for Thursday, April 16th. So at this time, I'm going to end my comments here, and I'll turn it over to the media if you have any questions for anyone today.
Troy Van Dusen, KXLG Radio for Mayor Sarah Tarrant, please.
Go ahead.
Good afternoon, Mayor.
Good afternoon.
Question for you. Speaking with a business owner in town today, of course, we all know how tough things are for our restaurant owners, and he expressed some interest, but he also had a good question. And the question, I guess, that I came away from that discussion with him on is, what are the parameters to reopen our restaurants? That's the first part of the question. Are there parameters to reopen some of our restaurants?
We don't have them set yet, but we have started talking about what they might look like. And certainly we want to be beyond our peak and to know that we are under control. We do not want to cause a second surge, and we don't want to overwhelm the healthcare facilities. But we are starting to talk about that.
Okay, and the second part of the question, I guess, is there any way that the restaurants could open sooner by putting additional safety measures in place, such as, say, single-use items, maybe like plastic silverware, that sort of thing, or maybe by restricting occupancy or that sort of thing? Is that going to come up in the discussion?
Absolutely. I think, yes, single-use silverware and, the social distance kind of a thing, just limiting the number of people in the facility. Absolutely. I think we can back off gradually that way, and that would be a good way for us to go back in a measured way so we don't see that surge that we don't want.
And then just a final question on that is, when do you hope to begin these conversations so that our business owners or restaurant owners have an idea about what to look forward to?
Well, there's really nothing stopping us from having them. So I guess if people are wanting to see something in writing, we can start working on that right away. I'd be happy to start working on that.
Okay.
Thank you.
And then, not to take up all the media time here, but there's a lot of information, and we're asking a lot of questions each and every day. There's got to be one story out there, Mayor, something good that's going on in Watertown that you've heard about besides strong towns. I know that's a great story, but there's got to be something else that's going on in our community that's positive that you can talk about.
Well, today's food distribution, I know we've talked about that a lot, but the number of people that have reached out to help with that is just amazing and heartwarming, and I think that's a great story for us to talk about.
Okay.
Thank you.
Dan Crisser from the Watertown Public Opinion. Obviously, and you alluded to this earlier, but piece of good news. 10 recoveries in Cottington, so that brings down the active caseload to 2.
Right.
And I guess kind of a two-part question, a little bit, but do you have any additional words about the recoveries and maybe what constitutes a recovery? Maybe.
Yes, and I think the healthcare workers are better at saying what those are, but there are very specific criteria, like going 3 days without medication and having no fever and without medicine. That's one of the things, and 7 days from your onset. And there's a set list of things which I can't rattle off the top of my head.
All right, and then obviously it's good to just only see the active caseload decrease then?
That's great. I'm really happy to see that. Only 2 active cases right now, and we've been steady the last couple of days with our case numbers, so that's a good sign. So we're taking it day by day, and I don't think we're out of the woods. I don't want anybody to think that we're ready to start backing off. I think we still have some challenging times ahead, but the good news is that we are prepared, and luckily we're in the middle of the country and we're kind of rural, And so we can learn from others. And also that when others are coming off of their pandemic and can share extra equipment, that's, you know, good for us. And we didn't have to be the first ones to experience everything. So
Okay.
that's really good.
All right, thank you very much.
Thank you. Any other questions for me? All right, questions for anyone else?
I have no questions.
All right, we'll end today. I appreciate everyone for showing up at a little bit later time today at 3:30. Tomorrow we're going to hope to return back at 3 o'clock, so we'll see everyone tomorrow at 3 p.m. Thank you.